Hey there, it's Dr. Overpeck again with another foot message for you. Do heel spurs cause pain? Is a question that I get just about every day in the office, and I just wanted to point a few things out for you today. Have a lot of patients who come in with heel pain, and many patients who wonder if the pain is a result of a heel spur. So I guess first of all, we want to define what a heel spur is, and I did bring my trusty foot model with me here today. And so oftentimes when patients come in with pain on the bottom of the foot, the bottom of the heel, which is an area right here, sometimes when we take radiographs or x-rays, we see that there is a little spike of bone. You can almost see it right here. That would be consistent with a spur. Now, typically, the spurs are usually not the source of the discomfort that patients usually have. Usually that's going to be more along the lines of the plantar fascial ligament, and that is typically the ligament that inserts very similarly or very closely to where you see the heel spur. And it's the main supportive structure of the arch that runs the entire length of the foot underneath here, all the way up to the ball of the foot there. So oftentimes I tell patients, if the spur was generally the source of the pain, we would most likely be, in the operating room removing these daily, and we essentially are not. We don't typically have to do that. Spurs that can oftentimes cause pain do occur most often on the back of the heel right here. We've talked about that in previous videos associated with the Achilles tendon. We typically will see heel spurs that may potentially cause pain. The good news is that we'll oftentimes get questions, well, is this a surgical problem, doc? Is this something that needs to be taken care of in the operating room? And most often the answer is no. We don't have to take these patients to the operating room, and we typically can see patients on a day-to-day basis who may actually have large spurs on the heel bone that typically don't have any pain. So we've learned over the years that is typically more of the plantar fascia causing the pain on the bottom of the foot, and we want to take steps to try to alleviate that. So if you are someone who's maybe been diagnosed with a heel spur or something along those lines, most likely you're suffering from a condition called plantar fasciitis. I've talked about it in previous videos. Again, I do have a book available that you can request from the website. If you would like to have an evaluation done, we'd be happy to see you. You can schedule an appointment very easily, either on the web page or by giving us a call. We'd be happy to get you in as soon as possible. Hopefully that kind of clears up a little bit of the mystery or the situation with respect to heel spurs, and hope that helps. We'll see you on the next one. Take care. Have a great week.